Okay, Paul.
Okay, thanks, Trish. I'm going to call the meeting of the Dundee Township 708 Mental Health Board regular meeting to order. The date is February 11th, 2021. It is 6:34. Trish, would you please read the meeting notice?
This meeting of the Dundee Township 708 Mental Health Board will be held via video audio conference call in accordance with the Illinois Governor's executive orders and disaster declarations regarding COVID-19's pandemic. The general public had an opportunity to receive access to this meeting by making a request to the township clerk, the township supervisor, or looking at the township website. Senate Bill 2135 was signed into law by Governor Pritzker to address electronic meetings during times when the governor of the state of Illinois has issued disaster declarations. Pursuant to this law, the Dundee Township 708 Mental Health Board meeting will be conducted by audio and video conference without a physically present quorum of the board. Pursuant to this law, Dundee Township Supervisor Trish Glees has determined that an in-person meeting at the township building with participants is not practical, nor is it prudent because of the disaster declaration associated with COVID-19 and all public health concerns affecting the township. This meeting is being video recorded, will be made available to the public via the Dundee Township website as provided by law, and all votes will be handled by a voice roll call. Thank you, everyone.
Thank you, Trish. Maria, would you please take the roll?
Yes. Trustee Don Arimura.
Present.
Trustee Borrero, present. Supervisor Trish Glees.
Present.
Trustee Alec Neuschaefer.
Present.
Trustee Cindy Oldin.
Present.
Trustee Paul Setze.
Here.
Trustee Wendy Witt.
Present.
Thank you, Maria. We have all board members in attendance, and therefore we have a quorum. So we'll proceed with the meeting. The next item on the agenda is to approve or amend the agenda as presented. Can I have a motion, please?
I first.
I have a motion first from Trish. Second, please.
Second.
Thanks, Don. Any discussion?
There's a typo on page 2 under new business, point D. I think Ansel's name is misspelled. It's a typo.
It's A-N-C-E-L.
Yeah.
It was such a different name that I noticed that.
Okay. Thanks, Don. I have one change to the agenda. This afternoon, or today, earlier today, we were contacted by Mary Crick at it's such a mouthful for me that I have to remember what the name of the organization is.
You're muted. I think she wanted to say something, but she's muted.
No, that's fine. Yeah.
Well, that's okay. Yeah, I have it on mute.
The Associates in Behavioral Health Care. And so what I'd like to do is change the agenda to place Mary to give a brief overview of the agency where she works and is as an administrator as well as therapist, I believe. And so I would like to put her after item 5 on the agenda, which is referencing the minutes from the last meeting. Does anybody have any objection to doing that? Okay, Maria, can you take a roll for approving the the agenda as amended with Mary Crick talking to us after the discussion about the minutes.
Yes. Okay. Trustee Arimura,
Aye.
Trustee Borrero, yes, aye. Supervisor Trish, please.
Aye.
Trustee Alec Neuschaefer,
Aye.
Trustee Cindy Oldin,
Aye.
Trustee Paul Setze,
Aye.
Trustee Wendy Witt.
Aye.
Okay, we have all ayes,
7 ayes. Okay, thank you.
7
Maria.
ayes.
Okay, proceeding to the next item on the agenda, can I have a motion to dispense with the reading of the minutes for the January 14th, 2021 708 Mental Health Board regular meeting and amend or approved as presented? Can I have a motion, please?
Moved.
Thank you, Don.
So moved.
Second, please.
Second.
Thank you, Wendy. Any discussion? Any changes or amendments to the minutes?
I'm sorry, who second? I was typing.
Wendy seconded.
Wanda, okay.
Yep.
Wendy.
Hearing no amendments or discussion, Maria, can you call the vote,
Mhm.
please?
Okay, Trustee Arimura,
Aye.
Trustee Borrero, aye. Supervisor Trish Glees,
Aye.
Trustee Alec Neuschaefer,
Aye.
Trustee Cindy Oldin,
Aye.
Trustee Paul Setze,
Aye.
Trustee Wendy Witt.
Aye.
Okay, we have 7 ayes.
Okay, thank you, Maria. Okay, Trish, would you take Mary off of mute?
She is off mute.
Okay, thank you. So I'd like to introduce Mary Crick. She's an administrator, also MSW, and a number of other acronyms after her name, with associates in behavioral health care located here in West Dundee, but also with offices in Roselle and St. Charles and Schaumburg as well. And she reached out to us and wanted to talk a little bit about what she does. I did forward at the very last minute a document that she had sent us, which provides an overview of the services. You may or may not have that in front of you, and I apologize for sending that out later than I had intended. But you do have it, and you can use it as a reference a little bit later on if you so choose. So Mary, I'd like to turn the meeting over to you, please.
Thank you so much for allowing me to come at such last minutes. I'm sorry that I forgot to do this last week when I noticed your meeting was coming up. I invited Danielle. I hope that's okay. Danielle is one of our executive directors, and how we really differ between us is basically I am associates in behavioral health care. It is a for-profit organization that works in substance abuse. We opened our office in West Dundee in 2008 in Century Plaza, and we've maintained that presence there the whole time. We really do find West Dundee as our home. I think one of the things that we're really proud of is that before we were one of the main sponsors for Nights Out for the West Dundee Police Office. And the year we actually did so well, it was 4 main sponsors, and then of course just out there just bagging everybody, you know what I mean? Actually, West Dundee was awarded one of the 10 top Nights Out program in the state of Illinois. And Nights Out is when you take your community and you go out and you meet community members. We had all kinds of fire trucks there. There was all kinds of events. Everybody was welcome to come. It was really a place of community organization. It's always held the same night. I think it's August 7th, if I'm not mistaken. And so one of the things that I really think is important is to let the community know that there's people out there to help them. And I think that's one of our main problems is that people don't really know that we're there, and sometimes they can't afford it. And so we do substance abuse. We've done substance abuse. I've been a certified addiction counselor, and I am actually at the supervisor level. So it's an international credential that I hold. I've been a counselor since 1991. I recently went back to school and finished a master's in social work, which really just helped so much more tremendously with mental health. My internship was at Elgin State Mental Hospital, and I really want to say there are so many things that people need, and the families we need, and the families that I worked with for the year I was there really need some resources. So what we do is we do substance abuse, we do mental health, and we do gambling services. I'm a certified gambling counselor, and West Dundee doesn't really have that much of let's say, terrible losses in the West Dundee community, but I did actually work with the West Dundee, I forget what it's called, that we do on September 7th, West Dundee Days. And it was funny because I had a poster up of how much the 7 bars made in West Dundee, and you would not believe how many people came up and was just looking. You know, there's a couple bars there on Route 72 that made over $100,000 in 1 year. And that's just their percentage of what they made off of those gambling machines. And March is gambling month, gambling awareness month, I should say. And so if we were to say that the house made 100,000, that means there was $1 million that was bet in West Dundee in 1 year. And you know, we all know West Dundee is not a rich community where we could just drop $1 million in a gaming machine and hope we win. So that's just one addiction. We work with people that have alcohol problems. We work with people that are on opiates. We work with people that actually don't have a diagnosable disease, but are actually on the way. And what that really created was we start seeing family problems. And so we started going to our domestic violence program. We are certified in the state of Illinois, and we work with the perpetrator. We definitely know the victim side, but what we found in our work is that a victim is going to get strong enough to finally leave their perpetrator, but the perpetrator is going to go find another victim. And so when we actually work with the perpetrator, we can actually stop the violence. And what that really came to is that we're working in substance abuse, we're working in domestic violence, is we're finding that these families are in such need that Danielle actually wanted to be, her actual title is she is the fund director. So FUN. So she has a place called Go Left. She chose that name because it means when things don't go right, we want you to go left. It's a youth drop-in center. It has all professional counselors. It is funded by a 708 board for the Roselle Bloomingdale Township. And really the worst thing I could say is it opened January 1st. Our party was New Year's Eve party for youth, free. And then March 14th, COVID hit. And we kind of shut down, but I do still let kids come in there. We follow all the protocols, we spray, we do everything we can. We have temperatures being taken. And what we actually are working on now is a parent support group. And I think the reason why is not only do the kids have problems, but parents have problems, families have problems, community have problems. And so I'm trying to look at my notes. I think we also do anger management, and we are certified at what they call nurturing parents. And so we want to actually just help families. And I should say, you know, unfortunately, there's a lot of families that can't afford help. And so, yes, we probably are going to see where we could fit in and some of the needs that you've identified in your community. I want you to know that we're here to stay. I mean, we've been here basically 13 years now in West Dundee. And Danielle, did I miss anything? I usually she'll tell me later. I forgot to mention, so I thought I could ask her now if that's all right.
No, you covered it. You just kind of went all over.
Oh,
I think
I sent them the paper so they could actually see it.
Perfect.
And I'll tell you one thing, I think I've met Trish in the parking lot of the 7-Eleven or the 611 building, because I'm looking at that building. It had a gym and it's got a cafeteria. What better place to throw a youth center,
No,
right?
no.
I mean,
No, it doesn't have any of that
it doesn't? How come there's
No.
a sign outside that says banquets?
because there's a banquet hall.
Oh,
It's not part of the township.
It's
It's
not
Oh.
part of the township building at all. It's a private entity.
but is it attached to your building? No.
Yes, it's within the building,
All right, well,
yes.
I'll have to call them then, because I just thought, you know what I mean? What better place to have a gym floor so that we could actually do some fun?
No, there's no gym floor though.
No gym.
No,
Okay.
it's like a banquet. Not that it's like a banquet hall. It is a banquet hall. That's it.
Okay. Well, then I'll have to keep looking for a good place.
Well, we have been looking in order to try to bring a youth center to West Dundee, trying to stay in West Dundee because this is home for us. But at least looking into where the township lines are actually. But my goal would be right here next to home. So that would be West Dundee.
Do you have any questions for us? I know there was a lot of material that we sent you, and that's why I thought it'd be better I sent it to you in print. And I'm really glad to see that you guys are part of the 708 board. I'm not sure if they shared my email, but I've been a part of McHenry 708 board. I'm sure I could get references from them, because really we took it from just a couple community members really talking about addiction and how to do it better to, it's a federal grant now that really runs some of their substance abuse prevention programs. And it really is, the 708 board does make a difference.
Does anybody have any questions at this time?
No questions, but your numbers about West Dundee and gambling were very interesting. Thank you.
And that was just West Dundee, I'm not leaving out East Dundee or, Huntley, or
Phil, yeah,
I'm not picking on West Dundee. I don't, but it is interesting, isn't it?
it is.
Oh, yeah.
Yes, yes.
I've
The man
noticed,
No, go ahead, I'm
I've
sorry.
personally been very, I don't know, deterred and bit skeptical of all of the slot machines I see everywhere. So I can kind of identify. But that's about it.
Anybody else?
Well, thank you so much for, and you, hopefully you'll see us around. Hopefully, we just want to make a difference. That's really what we want to do, is make a difference.
Well, Mary and Danielle, thanks for reaching out to us. And like I said, I did forward the document to everybody on the board. A little later than I told you I was going to do it, Mary. I got distracted by something else, unfortunately. But I'm sure everybody will take a good look at it, and I'm sure we'll be talking again in the future. We might want to ask you to come back and talk a little bit more about the gambling work that not quite sure what term to use, but the work you do with problem gamblers. Because that is not something that any of us have discussed here at the meeting in terms of the types of services that we might be looking at to fund down the road. So we might need to be educated a little bit more on that particular aspect of things. And we'll take we'll take a close look at the document you have, and we may have some other areas that we might like you to address as well in the future.
And I'm sure that you'll be putting out your needs statement. And so I'm hoping that substance abuse, mental health, and families will be right within your wheelhouse.
Yeah, we're almost at that stage. I'd actually hoped to introduce a document along those lines this evening, but it's not complete enough yet. But I do hope to do that the next go around, at least to start getting our arms around what types of needs we identified in the services that we think should go along with addressing those needs. So again, thank you very much. But I'm sure we'll be reaching out to you again in the near future for sure.
I have one more question, actually.
Sure,
So-
go ahead, Alec.
When you treat substance addiction, how different do you treat it than gambling? Or do you see it as one of the same, basically, because it boils down to an addictive personality, right?
Yes, and it is very similar. I think the problem is people don't see it as a problem because it's not that they're ingesting something. And so the denial is really up there, just as in substance abuse. And most of the time it's the family members that are calling us. My last family member just told me that she didn't know her husband was a gambler until the eviction was at her house. And she had to move her and her 5 kids out with a matter of hours because she had no idea they were that far behind. And so I think it's hidden. You know, if somebody's drinking or someone's doing drugs, you can actually like smell it. You can kind of see it in the person. But if you have no access to how much money is missing from the accounts, you don't really see it. So I think it's more hidden, where I think somebody that has an alcohol problem or a heroin problem might not see it, or sees it a lot faster than a gambling problem, unless of course they're going to the mailbox. But a lot of our guys and girls that are gamblers, they've already changed that mailing address. So, you know what I mean? The credit card statements aren't going there anymore. They're going somewhere else.
And the latest statistics actually shows, I think it was 89 or 85% is what I just read, is that because it's an impulse control disorder, that they do have a secondary diagnosis that either has already been identified or will be identified after treatment or during treatment. So it really goes with mental health.
Huh. Okay.
Okay, well, again, thank you, Mary. Again. Oh, I'm sorry, Maria.
Yeah, I just wanted to thank you first for your time, but also I wanted to thank you specifically for providing our youth with some resources. I think youth, you know, it's a tricky age, right? Because some of, you know, younger, like high school age are too young to be considered children, but then also they're in that age where they're finding themselves, they're trying to make so many decisions. And I feel like I think about them every time I went from education to law enforcement. So I think about how my kids are doing or how my previous students are doing, because right now in this pandemic situation, you know, there's a lack of resources for their mental health. So I feel like the fact that you guys provide that, and specifically for youth, I just wanted to thank you. I think that's awesome.
Also, we are doing a party on Friday in Roselle, and you guys are all welcome to join us. It's from 4 to 7, and the theme this year, or this party, because there's always seems to be a theme, is going to be Chinese New Year, the year of the ox. So that's right on Lake Street. If anyone's available, come and check it out.
Okay.
Some of our people actually did posters. We learned the alphabet. We learned how to actually say and write Happy New Year. And we'll, of course, we'll have Chinese snacks. I mean, that's the only way to go. You're more than welcome to come and see us, come and meet us and kind of see what we're there. I mean, it's nice. It is nice.
Okay, well, thank you very much.
Thank you very much. All right, now we will mute ourselves, but can we stay on or did you prefer we leave?
No, you're certainly welcome to stay on. It's a public meeting. Okay. Trish, I don't see any other people attending the meeting. We have nobody for public comments? Is that correct?
That is correct. And the last check of my emails, there were no additional notes or anything like that.
Okay. Then we'll move on to old business. An update on Acme. I have none. I've been forwarding emails to all of you as I get them for meetings and other things. I hope you find those useful, although I know all of you are quite busy during the day with jobs. But trying to keep you in the loop on what's going on with the organization, but I have no other updates at this time. Can we skip over SharePoint? Everybody's shaking their head yes. Okay, we'll do that. Does anybody have any other information to share in terms of just talking with people in the community about mental health needs or addiction service, addiction prevention services and those types of things? We have anything else to add tonight?
The only thing I want to add is that King County has gone for a $15 million grant, federal grant. It's more COVID related monies. And they have chosen, and I say the board has chosen that instead of having the townships, the 14 townships in the county handle the disbursement or the interview process. They have gone to the state level, and many of our residents, sorry about that, guys, hang on. Many of the residents are, they are misbehaving. I am so sorry. Many of the residents are very upset because they can't get through to HUD. So, I'm working, I will be working with my fellow supervisors to see if there's anything we can do to reverse this or what, but, due to this, the good thing is the stay of evictions is still in place. President Biden has extended it. The downside is at some point, everybody's going to have to pay their rent, and now they're having difficulty reaching out to HUD. So I'm gonna mute myself.
Okay. Okay, the fourth item on old business is the 3-year plan. Again, we'll table that for this particular meeting and deal with that in the future. So I'd like to move on to new business. And since Trish was going to be up first, I think we'll.
I can still be up first, just 1 minute.
Okay.
And they sound like small dogs, so they don't behave.
They are small dogs, and I'm very sorry. They're gonna drive me to drink today. I want.
And they're not yours either.
I have a class
Hey,
for
yeah,
that.
it's not mine. I'm babysitting them. Okay, so thank you, Paul. I have been appointed to the Regional Transportation Authority's there's a whole advisory board, and I am representing Kane County on this RTA board, and it is working with disability, ADA, and mobility transportation. So we meet once a quarter, and this was the first meeting of the year and the first one that brought on some of the new appointees. And what I have gleaned is that the RTA, although it's the regional transportation, really is Chicago centric. They're trying their best to work with what I'm going to call rural urban, which is what we are. But at this point, you know, they're struggling. You know, their idea is that if you are an ADA person in a area, now Dundee Township thankfully doesn't have this problem because we have ride and cane. But if you are in an area, you can either use your walker, your wheelchair, and get to the nearest bus stop, which could be a half a mile away in some of these locations. It's not like Chicago. So I am looking forward to sitting on this board and helping guide really our representation and how, what's important to Kane County to ensure everybody has mobility access. So I will ask Paul every quarter to let me give an update, and that'll, you guys can ask me any other questions at that point.
Okay. Thank you, Trish.
Thank you very much.
Okay, next on the agenda, Wendy, did you want
And
to talk to us about the Health and Human Services Advocacy
Yep.
event?
yeah, so I'm having the same issue that Trish is with two little puppies that think every Zoom meeting they are active participants. So hopefully they will be quiet while I do this. I sat in on the legislative session on February 6th. That was last Friday. And I really found it very, very interesting. There were six legislators on that call, and they went over their guiding principles, or at least the Health and Human Services opened by going over their guiding principles. Paul has emailed that to all of us, so if you didn't look at that, you've got it in your inbox. One of the things all the legislators said is that their funding objectives and goals for the upcoming fiscal year coincide very nicely with the guiding principles, the priorities of Health and Human Services. Couple of things that they went to, they being Health and Human Services, went to over and over again is that the goal in their budget asks is going to be to address, quote, embedded systemic racism, unquote. Talked a lot about budgets being moral documents, which I totally agree they are. That there is a need in the state of Illinois to focus on what they call service deserts. You may all have heard of food deserts. This is the same thing, only it's providing services to people, and they said it is most prevalent. The deserts are most prevalent both in urban centers and inner city areas, but also in rural areas, and that there is a clear desire among Health and Human Services to get services to the underserved. And then one of the things that ran through, and this is going to come as no surprise to anybody, but ran through everything that the people from Health and Human Services said and the legislators said, is that this is going to be a very, very, very tough budgeting year. There's no money, and they're getting an inordinate amount of requests because the need, right, is so incredibly high. And here they go. Hold on. No, we're not doing that. No. Don't you love puppy days? So what they said is if you submit a budget request to make sure it's short, succinct, and to the point, no more than a one-page budget ask. Do you want to know who the 6 people were that were on there and what their specialties are? Or I can also send you the notes I took, but just quickly, it was very bipartisan. I was impressed. Senator Julie Morrison, Democrat from Deerfield. She is the chair of Human Services, and her focus is on early childhood education, especially preventative early childhood education, saying there is a clear and distinct linear path between early childhood quality, early childhood education, and good jobs later down the road. So that was her. Senator Melinda Bush, Democrat from Lake County. She talked about the need for wraparound services, especially the need to focus on front-end services with a holistic and comprehensive approach. Representative Tom Demmer, Republican from DeKalb, LaSalle, Lee, and Ogle counties. I didn't have anything on what his focus is. Representative Teresa Marr, Democrat, Chicago's 2nd District. She serves the Chinatown, Pilsen, Bridgeport, back of the yards area. That's an area I used to live in, so I know it very well. It's highly diverse. It's also highly low income. And she talked about the chronic food insecurity in that area, but especially now, food insecurity is a very, very high need in that area. Representative Lamont Robinson, Democrat, serves a similar area, only in the 5th District. And he is one of the lead fighters to keep Mercy Hospital open. I don't know if any of you are following that, but again, that was right in the neighborhood I lived in when I lived on 33rd in Michigan. That hospital really services low-income, working-class, poor people. And if that hospital goes away, that community is really going to be in a healthcare desert. And he said he has made it his legislative priority to focus on healthcare inequities in the state. And then finally, Representative Jackie Haas, Republican 79th District, which is Kankakee, Will, and Grundy counties. She's LCSW with a focus on community mental health. You know, maybe you guys know her. But again, in servicing the underserved communities, and her focus is on prevention, early intervention, and access to care. So that's pretty much what they talked about was their priorities, and moving forward, moving those priorities from priorities to legislative resolutions. That's not the right word, but legislation that can be discussed and debated. But they said it is going to be an incredibly tough year. The next meeting is February 17th at 10 o'clock in the morning. I cannot attend that one as much as I would like to. That's Ash Wednesday. And I'm pretty much booked from 7 in the morning until 8 at night. So I don't know if anybody else would like to. They also recorded, so we can go back and find it. So that's my report on legislation. And by the way, I said this to Paul, I love tracking legislation and advocating for legislation. So it's one of the things I have done a lot in my adult life and ministry. So anything I can do along those lines, I'm happy to do.
Well, thank you, Wendy. Does anybody have any questions for Wendy? Okay. As Wendy said, and I believe I sent the follow-up email with the link to the recording. So you should all have that if you have the time to take a look at that. All right, Wendy, I see you got the memo about the red check shirt too.
I know, I was going to say that too. This is we are a pair.
Just trying to stay warm. Okay, moving on to the next item, which is the budget. Can I have a motion to approve the budget for fiscal year 22, starting on March 1st?
Supervisor Glees moves.
Thank you, Trish. A second, please. Is there any discussion? Okay.
I have discussion.
Sure, go ahead.
Just so you all know, I need to, once we approve this, I will then put it into the budget for the township board to see. As you know, once we've approved it, that's fine. But if you look at any of these and you think any of the numbers need to be changed throughout the year, we can do line item budgets, but not to exceed 10%. Okay, so the only one that I am gonna beat those dogs up. The only one that I have one
Actually, Trish, I'm very glad I'm not the only one. So
yeah. My only concern is commodities. I would like to add $2,000 to that so that make it 7,000. Because commodities would include our gas, our electric, any water, sewer type thing. That's my only, after looking at what I budgeted from the township's perspective, I just thought, kicking it to $7,000.
Okay, then in order to keep it balanced, should we reduce other expenditures by 2,000?
I was thinking of the contracted services, make that, take the 2,000 from there, move it up to commodities. And this way it could be interchangeable because it's still less than 10%. So if we don't use it, but we need more on the contracted, we could kick it back.
Okay. So that would, so change commodities to 7,000. That would take contracted services down to 2,655,650. I did my arithmetic right here.
Yes, that's what I had.
Okay. I thought what I do is I just do a quick review of the categories just to let everybody understand some of the logic behind this, and feel free to challenge it if you so choose. But commodities, we've already discussed. Travel, this is for primarily, like travel to the Acme conference or, other activities. This gentleman I talked to last week that Dawn had introduced me to, suggested very strongly that when we put our solicitation out for proposals, that it's helpful to reach out directly to people and agencies that might want to respond. Probably with COVID restrictions, we'll do that by phone these days, but he encouraged face-to-face meetings and visiting, the various agencies and the like. So that's the travel piece. The technology piece, if we move ahead, we decide, SharePoint isn't working the way we have it set up with our own personal email addresses or otherwise, we may want to go to a more closed-in system with specific email addresses to make it work the way Microsoft likes it to work. So there'll be some expenses there. If we decide to hire a caseworker, then there'll be technology needs around that, such as phone service and phone, computer, those types of expenses. So that's the technology piece. The legal piece, we have another item on the agenda to approve acquiring legal services. So we've set the budget at $10,000 for that. Catch-all category, other expenses for, because since we've never operated before, there may be some unanticipated expenses that, we haven't thought through at this point. Personnel, we have discussed, the possibility of bringing on a caseworker to help coordinate with people and getting them hooked up with the right services, also to serve as a bit of a liaison with police departments in the area that don't have their own caseworker, of which there's only one police department that currently does. Capital outlay, in the event that, well, first of all, if we do hire somebody, we'll need office space. Presumably, we'll do that at the township offices, but that might require some other work. There's also some other possibilities for capital expenditures down the road, depending on how what types of services and those types of things we decide to fund. And then the bulk of the budget, of course, is the contracted services for the year. So that was sort of the logic behind all of this. At this point, it's relatively vague, again, because we don't have a prior budget to work against. But it seems to be the one that makes the most sense to Trish and myself as we worked on this. So are there any other questions, discussions, concerns about the budget as presented at this point? As Trish mentioned, it will be presented to the Township Board for their information, and a public notice as well that goes out with the township and the road district budget. All needs to be done according to the law governing the township. So we're doing our best to keep Trish on track. to get a budget approved in a timely manner from the township trustees. So are there any other questions, concerns about the budget at this point? Okay, hearing none. Maria, would you take the roll call, please, to approve the budget as amended, where we added $2,000 to the commodities budgets for a total of $7,000, and we subtracted $2,000 from the contracted services budget.
Oh, not to be a stickler for Robert's Rules of Order, but do we need to vote on the amendment before we vote on the overall motion?
We do.
Okay,
So we'll have
to
two roll
vote on
calls
the
here.
budget,
So the first roll call will be on the amendments to the commodities, the addition of $2,000 to commodities and $2,000 subtraction from contracted services.
okay.
And
Trustee,
hold on, I think also, if I follow Robert's Rules of Orders correctly, I need a motion for that.
okay,
I move that we amend the budget. And Wendy, thank you very much. I appreciate that. But that we amend the commodities to $7,000 and reduce contracted services by $2,000.
I second that.
Okay, Trish, thank you for the second. Maria, would you take a roll call?
mm-hmm, 1 second. Let me- Trustee Arimura,
Aye.
Trustee Borrero, aye. Supervisor Trish, Glees,
Aye.
Trustee Alec Neuschaefer,
Aye.
Trustee Cindy Oldin,
Aye.
Trustee Paul Setze,
Aye.
Trustee Wendy Witt.
Aye.
We have 7 ayes.
Okay, so the changes to the budget is approved. Now, we go back to the original motion, which is to approve the budget. It'll be approved as amended. So Maria, could you please take another roll call?
Mm-hmm. Trustee Arimura,
Aye.
Trustee Borrero, aye. Supervisor Trish, please.
Aye.
Trustee Alec Neuschaefer,
Aye.
Trustee Cindy Oldin,
Aye.
Trustee Paul Setze,
Aye.
Trustee Wendy Witt.
Aye.
Okay, we have 7 ayes for that as well.
Okay, so the amendment passes, so the budget's approved as amended. Trish, so you can bring that forward to the board.
Thank you, everyone.
And thank you for keeping me on track there, Wendy. Sometimes when you go down these discussions, you forget.
No worries, no worries. Like I said, legislation is my thing.
Yeah, good. Okay, next on the agenda is a motion to approve the Ansel Blink letter agreement to perform legal work as needed for the Dundee Township 708 Mental Health Board. Can I have a motion, please?
Motion.
Thank you, Trish. Second, please.
A second.
Thank you, Alec. Ansel Glick is currently the legal counsel for the township. I had a discussion with Kurt Aspruth about having them provide legal services to the 708 board as well. And I did send out the agreement to everybody on the board. Briefly, I think it's important to have legal services because we don't know, what type of legal issues we may run into down the road. But I think it's also important to have legal counsel as we put out a request for proposals, as well as for contracting services going forward. I don't think any of us would be considered experts in contracting. My experience in contracting is in the software and services world. And while a lot of that is applicable here, not all of it is, and I certainly don't want to familiarize myself with all the Illinois state statutes to make sure that we do things the right way. So the only, I think the only other thing to understand here is that should a conflict arise between the 708 board and the Dundee Township trustees or the Dundee Township supervisor, that we would have to seek other counsel in those cases. I don't foresee that happening, at least in the near future, but I did want to make that clear to everybody on the board. Otherwise, it'll be on as needed basis. The rates are in the letter. I think the rates are reasonable. They're the same rates that the township is charged. And so that's sort of my summary of the agreement. Hopefully you've read it prior to the meeting. Are there any other questions, comments, or concerns?
I have a question.
Sure.
It's just out of curiosity. Would you guys be able to provide like an example of that happening? Like, what will be an example of us needing those services? Like, in what case? In what particular case? I'm just not familiar because I did read the flyer, but I just don't know why would they have to intervene or like provide legal services.
Oh, you mean between the township and the 708 board, or in general, what we would use? The
In
legal-
general, what would be like a law situation
They
or
would-
like a,
They would review every one of our contracts.
okay. So we're not particularly worried about like service doing like something unlawful, or are we? Like I just don't.
Well, I think, no, I don't think, I would certainly hope we're not concerned about doing anything unlawful.
Right. Mhm.
However, and I believe all of us are somewhat familiar with the legislation that we fall under. And it was interesting when I talked with Kurt, because we talked about there's several areas of the legislation that are a bit vague, and in some cases could be interpreted as contradictory. And so we talked a little bit about that as well. So his firm's knowledge, and he in particular have sort of an in-depth knowledge and history about some of this legislation that, you know, we certainly don't know. And they work with lots of other government organizations, as was indicated in the brochure. And so there may be times when we're not quite sure, for example, whether we want, I'll give you a specific example. I mean, and it has to do with homelessness. So one of the questions I had for him was, are we able to help the homeless with regards to shelter? Okay, you know, can we fund, I mean, in a broad sense, and I'm sort of summarizing the discussion I had with him, but, you know, could we provide a homeless shelter, for example? And we sort of went back and forth on this, and his advice was, no, you probably can't just have a homeless shelter. But if there was a way to tie it back to mental health or something like that, you know, you might be able to justify it in some way. And so it's things like that I think, you know,
Okay.
having legal advice is helpful. I also think it's helpful to have legal advice in your back pocket in the event that there are citizens within the township who may question what we're doing.
Okay.
Okay, and so, you know, would help one. And we know there are people in the township who aren't particularly fond of helping people in need, and have too much time on their hands, shall we say, and can be adversarial
Okay.
in some cases. So having a lawyer help you navigate through those things, I think, is helpful. Again, it's on an as-needed basis. I mean,
As
we're
needed,
not
okay.
paying a retainer. You know, we're just using the services as required, which is the way the township uses them as well. Kurt offered to come to the meeting. I said I didn't think we would have any specific issues with him, you know, or there'd be any specific questions from the board. But more than happy to put you in touch with him if you have some other questions
Yeah.
regarding that.
Well, I was
You
just
will
curious.
also-
I know it's like a brand new, but initiative. So obviously there's a lot of, we would like to be protected, right? So I feel like it's more like on a protection basis, like, you know, better have some sort of guidance than none.
Yeah.
So, but I was just curious to like, what would be like certain examples of what he has done in the past, or how has he protected other people? But I feel like you explained it very well. It does make sense. It does
Okay,
make
great.
sense. So
Yeah, it's to keep us within the rails, you know, the guardrails that we have to operate under. And
Okay.
I've been attending the township meetings for, I don't know, what, 18 months, 20 months now, Trish? And Kirk generally attends the meeting, or someone from the firm does. And I've had an opportunity to observe them. And the firm provide advice during the meetings. And I've been impressed by the work that they do. So I thought it was useful just to reach out to him. And because of his knowledge of Dundee Township in particular, I thought having that background would also be helpful to us. Is there any more questions, comments? Okay, Maria, could you take a roll to approve the engagement with the Untitled?
Okay. Trustee Arimura,
Aye.
Trustee Borrero, aye. Sorry, scrolling. Supervisor Glees,
Aye.
Trustee Neuschaefer,
Aye.
Trustee Cindy Oldin,
Aye.
Trustee Paul Setze,
Aye.
Trustee Wendy Witt.
Aye.
Okay, we have 7 ayes.
Okay, motion passes. Thank you. So I'll sign the letter and get that back off to Ansel Glick. The last item under new business is a motion to approve the payment of our Acme dues for calendar year now, not fiscal year, but calendar year 21, that should be, not 22. So that would be for January 1st, 2021 through December 31st of this year. The dues are $500 this year. And just to let everybody know, the following year, it'll be a percentage of our budget. So we didn't pay dues for the last 6 months of last year. As a trial, this is a full year of trial run with Acme. The $500 is their policy for new members. And so I'm looking for a motion to approve the $500 payment to Acme for calendar year 21. Thank you, Dawn. Can I have a second, please?
I move.
Thank you, Alec. Any discussion?
They are a great group. They've been very, very helpful with Bloomingdale Township 708 board. And there's a lot of templates that we can get from the various 708 boards. So they're a very organized group. Their annual meeting is amazing. And there's a new executive director, I believe.
Yes, Jody Dart.
Yeah. So it's a good group.
Any other discussion? Maria?
Just quick question. So it's supposed to say calendar year 2021, correct?
Yes, correct.
Okay, I'm
Yes.
gonna just edit it then. And then those $500 were already paid, or
No, we're voting on
okay,
that.
we're voting on it.
We're
Okay.
voting on whether to authorize the payment.
For this year, 2021, and then next year it will be a percentage of the budget, right?
Percentage of the
Correct.
budget.
Okay. I wanted to make sure.
Sure.
And also, do you guys know if the conference is gonna be virtual? Because I know they have an annual conference, don't they?
I
Yes.
don't, they haven't,
No,
they haven't decided yet. I think
Okay.
I think like a lot of groups, they're waiting to see if
Mm-hmm.
we can get over the hump on this pandemic.
Okay.
So did they have a meeting last year?
It was virtual, and wasn't it in December?
Oh, wait, I attended the meeting, the virtual meeting.
Was it January or December?
Yeah. Yeah, it was it was really late last year, like December or something like that.
Yeah.
Okay.
But I haven't seen anything that suggests when the meeting will be held this year. I'm sure the group would like to meet in person, but we'll just have to see, whether we can even meet in person, at some point during the year. So looking forward to that for sure.
The annual meeting is very popular with the downstate people, which is wonderful because it's held in downtown Chicago, and there is a lot of Christmas shopping that goes on.
Okay,
Paul, I have a question.
sure.
Of the 3 emails that you sent me, I felt like I was reading some of the stuff over again. What am I missing? Are they from some of the same people that are at the same meeting, only under a different group, or?
No, there seems to be, I know like for the advocacy meetings, there's a notice that comes out that saves the date. And then there's a second email that says, here's the information on how to connect to it. So it might seem repetitive, but there are actually 2. I don't, but Acme has a number of subcommittees. So like there's one on disabilities, there's one on legislation, which meets, I think, more regularly than anybody else, any of the other groups. There's one on Medicare, Medicaid. I haven't seen anything on that.
I just felt like I was 1 or 2, I was reading the same stuff over again, but I thought I was reading a different email from you. So I was wondering how that was, or.
Yeah, it's, excuse me. I think it's possible. I think it's, I don't think I've sent the same emails over and over again. It's possible.
Well, no, they're like under different headings, but
Yeah, so Jody
I felt
Dart,
like I was reading some of the same information all over again.
Okay,
yeah, sometimes Jody Dart, who is the executive director, seems to be on everything, and she seems to every once in a while rechurn something. So that's, Cindy, probably what you're seeing the most of, because I got that same sense. And I just want to say, with our membership, we do get to sit on any of the committees that we choose to. So if there's a committee that Acme has, like Wendy really likes legislative, you can sit on that committee.
yes.
And they are looking for committee members.
Right.
I just wish I had the time to look into committees. Like I haven't even had the chance. Every time I get the emails, they look so interesting, but it's most of the stuff is during the day, and it's just like, I really can't.
Real life interview.
Yeah.
Yeah, so with regards to the emails, when I get an email, I look at the subject line, and I'll usually, if it's announcement for like, an advocacy meeting, I usually don't go through and read every little piece of it. I just make a decision that I think this might be of interest to members of the board, and I forward it. So I don't carefully read every single email that I get from them. I filter out stuff that I don't think is relevant to the 708 board. And there's a number of other emails I get that I just sort of file away going, that's really not under our purview, or it's not something that is of interest to people on the board. So I try to keep the numbers down. Maybe I need to do a little more vetting to make sure that repeat emails don't go out. So thanks for bringing that up, Cindy.
All right, reading twice is always good for me.
There's no, I really, there's no reason for me to increase, the time people spend on things if it's repetitive. So I'll try to do a better job on that.
Well, and I also noticed that I didn't read all the way down on the one for the agenda. I only went so far and thought it was done. I got to go all the way down to make sure I got all.
Yeah, the forwarding, and that's, I think, the email client I use on my PC puts all the email addresses in there and when I forward the stuff. So I gotta see if there's an option for me to turn that off, because that's a huge list of people that's just, really of no use to anybody. So I'll work on that, but in any case, we'll try to do better. Like I said, sometimes I feel like I actually have a real job with all the emails that come in from Acme. And being retired, I like to, carve out some other time for myself and my wife. So.
Concept, what a concept. Hey, I am having a brain freeze here in the dead of winter. What does Acme stand for again?
The Association of Community
Health, mental awareness. Dawn, what's the I?
Illinois.
Illinois, thank you.
For Illinois.
Thank you.
Okay. Any other discussion?
Well, I was just wondering if I could say one, or actually two things, if I may. Is that all right?
Yeah.
Okay, so I forgot to say all of our services are also in Spanish, and so I apologize that I didn't realize that I missed that. The other thing is the gentleman that runs the 708 board in McHenry, his name is Scott Block.
Yeah.
And I know he's been around for a long time, but he loves to help people. If you were to reach out to him, I think you'd really get a lot of great information from him.
Yeah.
He's worked in the past with homelessness. He's worked in the court systems, and he loves teaching.
Yeah, he's the most recent past president of Acme through the end of last year. And during the virtual meeting, he and I had a brief conversation, and he said, reach out to me anytime.
But he's right in Crystal Lake. I mean,
Yeah.
he's like your neighbor, you know what I mean? But he really is. He's really a good guy, and he's very helpful. He really is.
Yeah,
he would be able to tell you all the mistakes he made.
Yeah. Yeah, and he's on my list to reach out to and talk to as we move along on this journey. So thanks for bringing that up as well. I appreciate that.
Thank you.
Okay, seeing there's no other discussion, Maria, can you read the roll? The motion on the table is to approve the $500 payment to Acme for the calendar year 21 dues.
All right. Trustee Arimura,
Aye.
Trustee Borrero, aye. Supervisor Glees,
Aye.
Trustee Neuschaefer,
Aye.
Trustee Oldin,
Aye.
Trustee Setze,
Aye.
Trustee Witt.
Aye.
You have 7 ayes.
The motion passes. Thank you, Maria.
Hey, Paul, I'm gonna need you to send me the bill with the approval to pay, please, because I can't do it myself. I mean, I can pay, I have to pay it, but you have to tell me to pay it.
Yeah, I will do that.
Thank you.
That was one email I didn't forward to people, was the invoice. Okay, so that finishes up the items under new business. The next item on the agenda is for open discussion. Is there anything else that people would like to bring up?
Wendy, yes, thank you so much for being the legislative point person.
Yes.
That's so important. Thank you.
Happy to do that. I am really happy to do that.
Yeah, I wanted to second that. Thank you so much. And thank you for the updates. I think they're so important. Everything you shared was very important.
Sorry, I can't make it on the 17th, but that's my day job.
I'll try to make it for you, Wendy. I can't guarantee it because that's board meeting day, but I'll try to.
If Paul can send the link again to the recording, I can watch it on the 18th.
Oh, okay.
I just
Perfect. Okay.
Okay, I can send out the link again. Sure. Let me just make a note of it so I don't forget.
I just have a
Um,
quick comment. Do we have any plans? I know with the guidelines moving up or down, I guess it's safer for us to meet in person. Do we have any plans on meeting in person or not yet, or?
The township is not opening the doors till, first of all, the township's not fully vaccinated. And we are waiting for an 80% vaccination rate in King County.
Okay.
And King County can't even make it to 2%, so no.
Yep. All right. Thank you.
And I will tell you, the coming from the state, the practice that's going to be, if you have, once you get vaccinated, the first time you get this white card, it's a chit. You are going to have to show that to get into public buildings. So,
Wow.
yeah.
Wow.
So we will be adopting the same policy.
Well, just as a comment to that, we at the police department are suggesting and encouraging people not to share their vaccine cards on social media to avoid scammers replicating or utilizing that information. So this is a safety procedure. We have been getting so many phone calls regarding COVID vaccine fraud. So just please be the voice of our community, encourage other people to stay safe. Do not answer phone calls that are, that ask you for personal information, Social Security. None of the agencies that are, payment, none of that is required when you are getting your vaccine. So just please help us out spreading the word. We're trying our best, sending newsletters and all of that. So.
Hey, Maria, do you have any, because I do watch Elgin's police website. Do you guys have like a flyer or anything, particularly that I could share with our food pantry recipients, which, 160 people, most of them are seniors. Do you have something? I've been looking for stuff, but I haven't gotten anything.
Absolutely.
Would you, could you get permission to share it with me?
Yes.
And,
I
and
know
then-
some of my flyers have the Elgin police logos because I've been like kind of recreating them and translating them into Spanish. But there are some public general ones about what not to say to people over the phone. And I can send them to you, but I can also send it to all of us. I think it's just helpful for, you would think it's common sense to not share and like answer phone calls, but these scammers, they're literally able to even record your voice, like, and use it for future purposes. So one of our priorities right now is making sure our seniors are, safe. And like, for example, today when I was doing the activity bag drop off, I was just making sure, giving them a scam prevention flyer, and it mentions all of the tips, all of the strategies that you should use, because it's people, scammers know that people are at home, they're using their phones, they're using their computers, so they're just using any type of strategy to get a hold of people's information. So I will definitely share that with you and share it with you all, because I think it's very important to be aware of that.
I can get the Bloomingdale PD scam prevention also for seniors. They have a police officer that comes to our senior center every year to do a presentation to the township, but also to the Bloomingdale Village seniors. So I will get, before she retires, I will get her.
Even if it means I have to recreate some of it, that's fine.
Yeah.
Yeah, no problem.
But.
Okay.
Did Alec drop off the call?
Yeah,
Yes.
I was just he just sent me a text. His computer died and he said he'll rejoin as soon as he can.
Okay.
Okay, so there's just a couple other things I just want to make note of. One is I'm working on a services solicitation document. I had hoped to have it ready for this meeting, at least for preliminary discussion. I hope to have it done in the next week or two, so I'll probably send it out early to everybody just for some comments. an input, to work it through. And I don't mind doing all the heavy lifting up front, but, having us all have input into the document, I think is really important, going, before we release it. So be on the lookout for that. The second thing is a gentleman reached out to Trish about Gambling Awareness Month. I think, Mary, you know about this. And there's Alec coming in. And I had a conversation with him earlier today about it. March is Gambling Awareness Month. And he was wondering if there was an opportunity for the township or the 708 board as a way just to publicize Gambling Awareness Month. I explained to him that we're really early on in our organizational structure, that we don't have a newsletter, we don't have a website, or any of those things at this point, that educating the residents of Dundee Township about what the 708 board does and what services are available is certainly one of, is part of our one-year plan. But we're not there yet. So I was wondering if there were any suggestions among the board members. Hi, Alec, thanks for getting back on. He's still not on audio yet, but that's okay. I was wondering if anybody else had any other suggestions as to what we might be able to do. Trish?
Well, we do have a website that's incorporated within the Dundee Township website. We do have our own page. Social media could be done. Do you want me to reach out to Mr. Dennehy to get some whatever flyers he has, and then I can post them? I mean, that would be the place. I could post them underneath the 708. And then I could also, on the website, we do have the news. Well, we have the newsletter too, but we do have the section where we, in the news kind of thing.
Sure.
I can reach out to him.
Okay. Yeah, Mary?
Thank you so much. Actually, he works for me. He's one of my outreach workers, and Danielle creates all of the flyers. So if we could, I told you she's the fund director. She makes them so people actually read them. If we could even promote anything that we could do for the community on your website, that's really what we want to do, is just get our word out. So
it cannot. So Danielle, I hope you can hear me. It cannot have any of your
company or identifying,
information. But if you want to make a flyer, that comes out, I can definitely get those on there. You can send them directly to Trish, TRISHG at Dundee Township, and I can get those flyers out there. But it can't have any sales information, if you will.
But it can have the state website. Is that correct?
That is correct. It can have the state website on there. It just can't have your company's website.
And that's okay.
Yeah.
I appreciate that, because really, you know what I mean? That's all we want to do, is just get the word out for.
That's fine. We can definitely do that.
Yeah. And we could do something. We could do something in your next newsletter as well, Trish, right?
That is correct.
Yeah,
Right.
I was just gonna ask Trish if you are direct. I'm pretty sure you work with the person who manages social media for the township, or
Yeah, I know her really well.
is it you?
Yes. Yeah.
Oh, okay. To be honest, I haven't been. I'm really. I manage one social media page, so most of the time that I'm at social media, I'm just managing the other social media page. But is it Dundee Township, or is it Dundee Township Park District?
No.
No. What is
No.
the Facebook page?
Okay, so there's Dundee Township is a Facebook page. There's
Okay.
Dundee Township Supervisor Trish Glees. There's
Okay.
Dundee Township Open Space.
All right.
So
So
there-
are we gonna do like a subcategory one, like a
No.
different page? No.
No.
Okay.
No, so it would be under the Dundee Township.
Township. Okay.
Yeah.
So all the flyers we're talking about, we're hoping to post them there as well, right? Or
Right, it'll be posted
okay.
there, it'll be posted on the supervisor's page, it'll be posted,
Okay.
you know, it'll be posted on the website.
Awesome. And then, yeah, we have a little tab on the big website, right? Don't we? I thought
Yes,
I
right,
saw,
we
yeah,
have, yeah,
with our pictures and some of the
Right.
legislation, like a summary, right? Because I think I remember seeing that at the beginning last year.
right, which some people haven't given me their bios or their pictures, but I'm not gonna complain about.
Guilty.
Okay, cool. All right.
Okay,
I just wanted to know. So it is Dundee Township on Facebook.
Yes, it's Dundee Township.
Okay, cool.
okay. Okay, those were the two other items that I just wanted to bring up during open discussion. Is there anything else? Anybody have? Okay, hearing none. Our next meeting is Thursday, March 11th. Mary, just so you know, we meet the second Thursday of every month for, those are our announced meeting dates for calendar year 21 at 6:30. So that's the next meeting. I will entertain a motion for adjourning the meeting.
I move.
Okay,
Second.
Right.
thank you, Maria. Thank you, Dawn.
The same link, or should I email Trish every time we want to come?
So what you need to do is on the well, yes, you can email me, but on the website, there's a little box. Okay,
Okay.
it'll tell you what meeting's coming up. It's our event box. You know, if there's a snowstorm, you know, that kind of thing, it might get bounced. But right on our website is a box and it'll have the dial-in information.
Okay, thank you so much. And I really appreciate you guys. I know that you don't get paid for what you do, and it really means a lot to the community.
But you can call me or send me an email, which I just sent over to Danielle, but my email's public anyway. And I'll give you you know, I can give you the information if you want to be on the meeting standing all the time. Like I do have some public people who want to be on the meeting standing. I just send the invite out. So you just need to tell me.
Thank you so much.
Okay.
Okay. Maria?
Before we move to adjournment,
Sure.
the regular meeting of the Dundee Township Board of Trustees is Wednesday, February 17th at 7 p.m. You know, should you want to attend, just giving you a heads up.
Thank you.
And Paul's speaking.
Yeah. Okay,
Oh, but it's Ash Wednesday, so I'm with Wendy on that. I do.
Yeah.
Yeah.
What's the topic?
He just
I give us during the even numbered months, Trish has asked me just to give an update on what the 708 board is doing. So I try to keep it, you know, to the basics of what, you know, where we are and what we're doing and what we're planning.
Awesome.
So I think any other
I can
discussion
do the
about the
roll call.
agenda?
Oh,
Okay, Maria, could you take the roll call, please?
yes. Trustee Arimura,
Aye.
Trustee Borrero, aye. Supervisor Trish Glees,
Aye.
Trustee Alec Neuschaefer.
He gave an aye.
Oh, okay. Trustee Cindy Oldin,
Aye.
Trustee Paul Setze,
Aye.
and Trustee Wendy just messaged us. She had another meeting, so is she excused or
She's absent, I guess.
Yes.
absent?
Yeah.
Okay.
He is now absent, right?
So
Okay, so
six ayes.
6 ayes and 1 absent.
Okay, great.
Awesome.
Thank you. The meeting is adjourned. Trish, could you please stop the recording?